Some estimates indicate that we spend about $30 billion annually on inhalers. Medication inhalers are foundational therapy. There is consistent evidence that patients do not use their inhalers optimally. We at Michigan Medicine assessed patient technique. The data was collected by amazing colleagues. The work was performed for an advancing healthcare project for Michigan Medicine in 2023. The work was completed in 6 weeks. Have you ever had dyspnea? Because kids have smaller airway diameters, they become dyspneic very quickly. You are familiar with treatment of asthma and COPD. What is the problem? What is the foundational intervention for these patients? Do patients use their inhalers effectively? What is required for successful learning? Pulmonary rehab centers offer a unique opportunity to provide durable inhaler teaching. The American Lung Association estimates that annually these two indications result in about 2.6 million emergency department visits and over 500,000 hospital admissions annually. The annual impact is 3.1 million ED and hospital visits and an estimated $74 billion cost to the system. Impact is on people, not numbers. Teaching improves technique. Teaching at a single time point reduces acute care visits at 4 weeks by 20%. So what do we do? Because we included a wide variety of participating units, a pulmonary rehab center, inpatient service, and interventional pulmonary, an instructive data set was collected. A questionnaire was developed from published sources. We assessed 33 patient trainings. The majority were female, with over 40% older than 65. In the 10 error categories, the rates are in the 13 to 46% range. Of the 10 error categories, 7 categories, or 70%, have an error rate of 20% or greater. Time is required for successful education. About half the patients need more than 8 minutes. Shown in the previous slide, due to psychomotor coordination limitations, therapists recommend meter-dose inhalers with spacers in 73% of the patients. We educate our patients to use their inhalers, but Hermann Ebbinghaus quantified in 1885 that we must repeat and relearn skills over several weeks to retain them. Retention of psychomotor skills to use inhalers can occur over the 8 to 12 weeks for patients in rehab. So where can this education take us? Lack of teaching to her, to him, has consequences. The observed high frequency of errors ranges from 13 to 46%. The observed technique error rates are consistent with reported numbers. For meter dose inhaler users, which is the majority, spacers are underutilized. Therapists recommend meter dose inhalers in 73% of the patients. We propose the hypothesis that effective inhaler teaching across the healthcare system could reduce the annual 3 million plus ED and hospital visits linked to COPD and asthma by 10%, or a whopping 300,000 admissions. Therefore, we believe that pulmonary rehab centers are a resource for effective inhaler medication teaching. We would like to thank the many respiratory and exercise therapists, the 5 committees and departments, the diverse group of professionals from these 5 committees who provided guidance. Thank you.